Hi, this is Dr. Ilya Skolnikoff coming to you here live from Wilbur Hot Springs, which is about 2.5, maybe 3 hours north of Marin County in Sanrafael, California. So we're not in San Rafael, we're here in Wilbur Hot Springs. So just kind of thought I'd get in the mood and maybe share with you a few tips about some things not directly related to what we're doing here, but just related to things in general. So when we're going into the hot springs, the high mineral content waters that are coming from the earth, those minerals help your body to do certain biochemical reactions that they wouldn't necessarily otherwise be able to do because of certain mineral deficiencies that are extremely common to our modern society. The modern society that we live in is kind of something that's really stripped us from many of the minerals that we should have, were we eating more mineral-rich foods. But unfortunately, most of us don't eat all organic food all the time. And for those of us that do, even the organic food is depleted of many minerals now, just because over the last, I'd say, 3,000 years, a lot of the minerals have washed down into the oceans. So now the oceans are really dense in minerals. And so a lot of people have also gone and looked towards sea vegetables as a source of nutrition. So many nutritional supplements now include nutritional compounds that come from the sea, or just vegetables that come from the sea. Some of the best being kelp and bladderwrack and dulse, etc. Okay, bladderwrack actually can completely heal certain people from hyper and hypothyroidism, but it doesn't mean you're supposed to just start taking bladderwrack. You need to make sure that you're doing it under a licensed healthcare provider's supervision and not just start playing games with your own body. So anyway, I wanted to share with you a little bit about silver amalgam fillings. A lot of people are, especially people who are around my age, I'm 48 years old, a lot of people when they were younger received fillings, and they looked like silver, right? But they're made of mercury, amalgam, and silver. Sometimes they mix other compounds in there, such as nickel, and these are toxic heavy metals. So I mean, they're not always heavy, but on the periodic table of elements, they don't necessarily show as being heavy. But when I use the word heavy metals, it's a term used loosely for rare earth elements or heavy metals or metals that cause difficulties with human health. They cause disease and dysfunction. The main diseases that they cause are heart disease and also cancer. I'm really simplifying things here. I'm just kind of giving an overall picture of what goes on. So we need to really, really watch out for that. Some people just can't really heal nowadays in our modern world that we're living in because we're exposed to so many chemicals. If they have, go ahead and go onto YouTube right now. Don't wait until the video's over. You could just stop my video and do a search for smoking teeth on YouTube, and silver amalgam or mercury fillings and smoking teeth, and you can watch this video that shows gases coming off the teeth. Basically, it's mercury gas, okay, literally, mixed with silver, that come off a silver filling that's only a year old, sometimes less than, yeah, I mean, a year is nothing, right? A lot of people have had these silver fillings in their mouths for over 10 years, and mercury vapor is going into their body, and their brain is right up here. It's going right in there into their mouth, sometimes for many, many years. Older the fillings, the more they leak mercury. The newer the fillings, the less they leak mercury and the less damage they do. Mercury is highly, 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 highly toxic. Mercury causes all types of health concerns. I don't even know where to begin. A lot of people who are ending up with, I know there's not a direct relationship, but just bear with me, polio or polio-like symptoms ended up being those people who were exposed to mercury. This was much more common around the turn of the century, like 1890, 1880, 1850, all the way through around 1904, 1912. And then, it was kind of phased out. They used to put mercury in medicines. Yeah, they did. They did this all the time, okay? Not funny. I'm only laughing because it's so ridiculous. I mean, we look at that today and we say, how could they ever do that? If you know the Mad Hatter, the character from Alice in Wonderland, that character was based on somebody who got mercury poisoning and started hallucinating, which a lot of people were doing. Like I said, right till the end of the 1800s, 1880, 1890, 1895, up until 1905, 1910, 1912, and then it died out because, well, it didn't really die out that much. By the time the 1940s rolled out, I mean, people were starting to catch on that maybe this wasn't the wisest thing to put in the medication. But all the way up until the 1940s, they were doing that. Okay, so we've talked about the silver fillings. I hope you get the basic idea. Also, kind of getting a little uncomfortable here on this hammock, but go to Hal Huggins. Hal Huggins is a dentist you can find on YouTube, and you can start to watch his videos. His videos are really great, and they'll give you a lot more information. I'm just trying to get comfortable. Hope you don't mind me moving around here. His videos are really great. They give you a lot more insight into like doing root canals. Root canals are not a good idea. Why? Because a focal infection, a little cancerous infection, can be at the root of the root canal. They call it a root canal because they're trying to clean out the canal where the nerve root is, because there was an infection there. So I'm really simplifying things, and I'm not a dentist, so that's why I'm kind of referring you to a dentist who's on the internet who's giving a lot of good information about this. But anyway, the infection, if it's not taken care of all the way, meaning if it's not cleaned out, or if it's not cauterized, meaning burnt, or a laser's not used to make sure that the infection is completely resolved, it can still be there even when they put a cap or something on the tooth. So it's better to pull the tooth and then do an implant. That's really the way to go. But if you do a root canal and the infection's still there, it leads to what's called a focal infection, which is basically a precancerous infection. Okay. A lot of things are happening here at Wilbur Hot Springs. You should see what's happening in the environment. I'm being a little bit sarcastic. My wife's over there at the car. She's waiting for me. Okay, so let's just keep going here. I think you got enough information about the dental fillings. Another thing that people do, new patients seem to get into trouble with, is they end up having the wrong eyeglasses prescription. So the wrong eyeglasses prescription is bad news. I'm sorry to be the one to tell you that. Most of the information that we're getting from the environment is coming in through our vision. We're a very visual society. That's why we get so much information from the stuff that we watch on TV and the things that we read and things that we see. Oh, those dishes are so beautiful. Look at the trees. Look at the deer. Look at the hammock. Oh my God, look at that, man who's so attractive, or that woman who's so attractive. And did you see that commercial? It's all very visual. We're a very visual society. If you have the wrong eyeglasses prescription, all that information is distorted. What is good becomes bad. What's happy becomes sad. What's right becomes wrong. What's good, we just said that. What's mad becomes happy. What's strange becomes normal. So with all these unusual reversals, called psychological reversal or umbilical reversal, okay, with all these inconsistencies, we have a life full of confusion, and that can just happen from the glasses. It's almost as though you're getting an injury from having the wrong pair of glasses, and the injury is to the brain directly, which is processing all the information coming in through the glasses. But that injury is not actually an injury. It's just a temporary thing until you go to a properly trained neural optometrist or behavioral optometrist who's trained to help you with eye exercises. Not that you need them, but they would have the skills and training to do that, and they can then determine the correct eyeglasses prescription for you. Not that this happens with everyone, but in our particular patient population, I have no idea exactly why it is, but it seems that a huge percentage of people need a new pair of glasses. I'd say as many as 40%. I mean, it is absurd. So this has been one heck of a video that we just did for you here. I hope you've gotten a tremendous amount out of it. There's a lot of other things, but we got to go. Thank you for staying and watching this really helpful video. If you see it on Facebook, give us a thumbs up. If you see it, wherever you see it, you should go to our YouTube channel for sure. Check us out, Thyroid Health Family Healing Center. Like our Facebook page, like our YouTube channel, and or you could give us a love, share it with friends. Thank you for watching.